Sugar's grip on human behavior reflects sophisticated neural mechanisms that parallel pathways implicated in substance addiction. Understanding these neurobiological underpinnings explains both the difficulty of reducing consumption and the strategies most likely to succeed. Functional neuroimaging reveals that sugar consumption activates the brain's reward circuitry, particularly the nucleus accumbens and ventral tegmental area, triggering dopamine release comparable to drugs of abuse. This dopaminergic signaling evolved to reinforce behaviors promoting survival, but modern refined sugars deliver concentrations and absorption speeds far exceeding evolutionary contexts, potentially hijacking these systems. The development of tolerance mirrors patterns seen with addictive substances. Regular sugar consumers require increasing amounts to achieve equivalent pleasure responses, as dopamine receptor density downregulates with chronic stimulation. Studies comparing brain activation patterns show that frequent consumers exhibit blunted reward responses to standard sugar doses compared to occasional consumers, paralleling the neuroadaptations observed in substance dependence. Withdrawal-like phenomena further suggest addictive properties. Individuals attempting sugar reduction commonly report irritability, cravings, and mood disturbances during initial abstinence periods. While these symptoms prove less severe than classical drug withdrawal, animal studies demonstrate that sudden sugar removal after chronic access produces measurable anxiety behaviors and stress hormone elevation. The craving cycle involves complex neural networks. When blood sugar drops or environmental cues trigger associations, the prefrontal cortex, governing self-control and decision-making, shows reduced activity while reward anticipation regions show increased activation. This neural imbalance biases behavior toward immediate gratification over long-term health goals. Importantly, debate continues regarding whether sugar truly merits classification as addictive in the clinical sense. Some researchers argue that food reward differs fundamentally from drug reward and that overconsumption reflects normal motivational systems responding to palatable, calorie-dense foods rather than pathological addiction. The operational definition of addiction requires clinical impairment and continued use despite negative consequences. While this describes some individuals' relationships with sugar, it doesn't universally apply to all consumers. Nevertheless, the neurobiological similarities provide actionable insights. Approaches effective for substance dependence show promise for sugar reduction. Structured reduction protocols preventing sudden complete abstinence reduce withdrawal intensity. Cognitive behavioral strategies identifying triggers and developing alternative responses leverage prefrontal cortex capacities. Mindfulness-based interventions strengthen awareness of automatic eating patterns, allowing conscious choice to override habitual responses. Environmental modification proves particularly effective given neural vulnerabilities. Removing visual cues that trigger cravings, keeping sugary items out of sight, reduces automatic consumption. Creating friction through inconvenience counters the reward system's preference for immediately available gratification. Social support enhances success rates substantially, as social connection activates reward pathways that can partially substitute for sugar-driven dopamine release. Support groups or family-based interventions leverage this neurobiological reality. Understanding the neurobiology also fosters self-compassion. Difficulty reducing sugar consumption reflects powerful biological drives, not simply lack of willpower. This perspective can reduce the shame that often accompanies failed attempts, enabling persistent effort despite setbacks. The practical implication is clear: treating sugar reduction as a neurobiological challenge requiring structured strategies proves more effective than relying on willpower alone. The brain systems governing reward and motivation respond predictably to environmental design, habit modification, and gradual change more successfully than to sudden deprivation mandates that pit conscious intentions against deeply wired neural circuits optimized for securing concentrated calories.